Um, Hello, good morning, everyone, and welcome to the second session for our to the second information session for the Grand Challenges Nigeria RFP request. You're all welcome. We have not started, even though we're live. As is usual, we like to give 2 or 3 minutes to stragglers to arrive. But you're all welcome, and I think we should also wish you a happy new year. It's good to see everyone, and we wish you the best of the year. So like I said, we'll give it 2 or 3 minutes and then Dotun will officially start. Please note that automatically, because this is a webinar, this is being recorded. And we'll make the recording available at the end of the webinar. I see some people have started to introduce themselves in the chat. And so, yes, we do invite you to introduce yourself to other participants in the chat to a great opportunity to network and meet other researchers and innovators elsewhere. But specifically for the information session, please note that when you have questions, the ideal place to post the questions are in the Q&A. So we will monitor questions in the Q&A and answer them as quickly as possible. If, however, you have challenges with the Q&A, then you can put your questions in the chat, but please know that the questions in the Q&A is what is being prioritized. We know that some people who join on their phones can often struggle with the Q&A. If that's the case, please just put your questions in the chat. So we'll give it 1 more minute and then we'll start officially. Thank you. Okay, so once again, welcome everyone to the second information session to support the proposal applications to the Grand Challenges Nigeria request for proposals. We are happy to have those who are here for the first time, and for those who are here a second time, we're also happy to have you. As I indicated, this is being recorded. The first session was also recorded, so you can access that on our YouTube channel. If you don't have it, please don't worry. This session will also be recorded, and you will get this in your email afterwards. And we'll also put the link to the first session as well. So please don't worry about that. Just some ground rules. The chat is for general conversations, especially introductions, as you will see is already going on. The Q&A, however, is for asking questions specific to the RFP, and we'll prioritize those questions. I see we already have one, and answer them during the course of the presentation. So please put your questions there. Last time, those who were on mobile kind of struggled to use the Q&A. If that's the case, you can put your question in the chat, and we'll make sure to try to find them as well. So we'll just start with a general introduction. We'll keep it light so that it's not, it doesn't take too much time, and so that we can have more time for questions at the end. First of all, my name is Godwin Bamsa. I am the Senior Program Manager for Grand Challenges in Nigeria. And my colleague, Dr. Adidotu Owolabi, is the Technical and Information Lead for Grand Challenges Nigeria. I think there are two other people on this call. They are not presenters. That will be Professor Falake Samuel, who is the technical lead and for the program, as well as Aminat, our colleague as well. She's also on the call. Now, just as an introduction, Grand Challenges, and we have started to do a different type of introduction just to help people understand what we're doing and how it's different from other funders. Grand Challenges as a concept was born a very long time ago, and the whole idea of Grand Challenges is often you have pockets of individuals or organizations who are working on the same things or on similar things. And so it's usually pockets of work, but the question is, how do we get everybody to work on the same thing so that we concentrate the resources, we focus the questions, and have the most impact? So if you read the history of Grand Challenges, there have been successes with that idea and that type of implementation. Not exactly Grand Challenges, but some similar examples would be the MDGs and the SDGs, where the issues were defined for everybody and everybody was working on the issues. So that is an idea of what a Grand Challenge is. For the Grand Challenges that we run, we are a family of initiatives. Typically funded by the Bill and Melinda Gates. We have Grand Challenges across the world. Some of the more famous ones include Grand Challenges Canada, but we've also got Grand Challenges India, Grand Challenges Brazil, Grand Challenges Africa, and then we've got the country ones like Rwanda, Senegal, Ethiopia, South Africa, etc. But we haven't had a Grand Challenges focusing on Nigeria's problems until now. And so Grand Challenges Nigeria was launched last year, and its remit is more narrow than, say, that of Canada or that of Africa. The remit is just going to be Nigeria. So we will be defining priorities for Nigeria, and that is a big part of what we do. We've got quite a few partners and board members who we do that with, including the federal government and other players in the sector. And then we will also concentrate resources. And when we say we're concentrating resources after defining the problem, that includes the grants that we give, but also community of practice of researchers and innovators that will pull together around each issue that we decide to fund. The first issue that we'll be funding is what you see on the screen. So it's in maternal, newborn, and child health, and we're trying to advance innovative solutions for challenges in this space. The RFP is online on our website. Dr. Dotun will provide details about it. And this particular request for proposals is for seed funding. And so what that means, and Dr. Dotun will provide details, is we'll provide seed funding to those whose proposals then qualify. But because it is seed funding, the implication is that there will be scale funding, and that is true. So for those whose implementations then meet certain criteria, including capacity to scale, there will be scale funding. In addition to this pillar, there will be other pillars and other calls for proposals in other pillars that will come through. So we expect that most of the people who are here will be interested in innovations in maternal, newborn, and child health, but our remit is in health in general and food systems as well. So please, for other colleagues, or if your remit extends beyond MNCH, then please look out for future calls in other pillars separate from MNCH. This is the first call for MNCH, and by this I mean this seed call and the subsequent scale call, but there will be additional calls as we refine the issue, as we see the progress that we're making towards solving the issues for Nigeria. So it's going to be a long-term project. It's going to be aligned to national priorities. And this is exactly what Grand Challenges seeks to achieve. So that is the summary of Grand Challenges. Grand Challenges Nigeria, what it is, the background, what we're trying to achieve in its full remit. And I will hand over now to Dr. Adedotun, who will talk about this specific RFP and what we're trying to achieve here. So, Dotun, over to you.
All right. Thank you so much, Bamsa. Can you hear me? Can everyone hear me? Bamsa, can you hear me?
Yes, clearly.
Great. So good afternoon, everyone. It's good to have you here. Thank you for joining us. Indeed, we felt it was very important to, as much as possible, provide necessary information to everyone with regards to the application process for this RFP. Usually the RFP application information session for the first one, it's not different from this session. It's the same. Usually what we should have is a different set of participants who were probably not available at the first information session to be part of this, because we already have this recorded and you already have the email. So we believe there are quite a number of people who were not involved also or part of the few of initial session. And so, but as much as possible, we will ensure that we provide necessary information for everyone to have in order to provide a very competitive application as much as possible. So a brief look into the key dates and deadlines. We already launched these grant challenges, and also the proposal request for proposal has been announced. We had the information session already, first information session in December, and here we're having second information session. Already we have received quite a number of applications coming in. We have seen hundreds of applications already in progress. So we can imagine that quite a lot of people are happy about this opportunity, and we are happy about it, that you see it as a very good opportunity for you to share your innovative ideas and implementation with us. So thank you so much for application. Please keep your applications coming in. We're looking forward to receiving them and also to reviewing them as possible. This proposal the deadline for this proposal is January 31st of this year, which is at the end of this month, this very month. Today is a 13th day of the January, and so we have a couple of more days of few more weeks to go. And so please as much as possible, please put in your application. And of course, like we rightly said, a very competitive one. But because you can imagine the strength of applications coming in already. In March, we will complete the review of the proposals, and then at the end of April, selection and the award will be announced. We will do our due diligence and contracting for the selected number of people at the end of May. Just like my colleague said, this is a seed phase application, a proposal, and so we will complete the due diligence and contracting for this phase, and then we can commence the implementation of the project that have been selected. Bamsa already gave a very detailed information about who are we, what are we doing, what are we after. Just like he said, we are pioneering initiative committed to driving innovation that address critical health, food system, and development challenges across the nation, Nigeria. And what we're looking forward to is building a platform where we can identify strategic areas for investment, where we fund innovation and fostering, of course, a dynamic ecosystem where Nigerian innovators can come together and provide adequate and provide solutions to our local health, food system, and development challenges. So that's basically one of our mission. We would be providing funding, capacity building, strategic partnership as well, in order to accelerate development and implementation of solutions that improve health outcomes, thereby, of course, providing supporting the food security, promoting sustainable development across the nation. What you see is at the end of the day, organizations across the country are currently implementing projects individually, right? And so you can imagine if you will now have multiple organizations implementing studies or projects, innovative projects in the country, at the same time, simultaneously, we will be able to accelerate the development within the food system, within the health system, within the sustainable development goal, across the country, and so this is one of the things we want to do, to see how we foster these local researchers and innovators, and see how we can accelerate development as well as the implementation of these great solutions that you have for us and in Nigeria. The objective of this session basically is for us to share with you our expectations, what we require and what we expect of your applications when you submit them. We would be sharing with you those criteria that you need to know about selection process. We want to share with you the scope of the call, the eligibility criteria, like I said, evaluation criteria, and of course, we want to give you some more tips on how to craft a very competitive application. So that's basically what we are going to be looking at in this particular session. You want to ask, why are we looking into MNCH call? This is a very important question in case this is on your mind. Yes. In 2023, the United Nations reports on trends in maternal mortality from 2000 to year 2022 showed that nearly 28.5% of the global maternal death happens in Nigeria, as in our own Nigeria. Indirectly, you can say about one in every 19 lifetime risk of dying during pregnancy or during childbirth or during postpartum, and if I compare that to the developed country, I mean, you probably will have one in a 5,000 or one in a 4,000. It depends on which country we're talking about. So for early childhood mortality, just like you can see in this current slide, the death per 1,000 live birth in the 5 years period of preceding this NDHS 2024, what you see is that from 1990 straight down to 2024, we haven't really improved so much. You can see from under 5 mortality rates from 193 in 1990, we still have about 110 children dying before they are 5 years old. That's quite high. That's on the high side. See, infant mortality rates from 87 in 1990 now down to 63. We haven't made so much progress in the span of almost, 24 years. That's very important that we know. If I compare this also now to the UK and to the US, these two country, for them, for every 1,000 in the UK, only 4 children die. For every 1,000 in America, only 5 children die in their infant mortality rate survey. We want to get to that level. We want to also ensure that we don't even have any child dying. No child is worth dying at all, before they clock 5 years. Neonatal mortality is also very high, 41%, which is still very, 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 very high. And this is one of the reasons we are calling for this particular call. Look at the trends in childhood vaccination. Percentage of children between the age of 12 and 23 who are fully vaccinated. Vaccine, as we all know, is a very crucial treatment or management for children to protect them from different types of diseases that flies around everywhere here and there. But then look at this, about 39% of Nigerian children between the age of 12 months to 23 months are only vaccinated. Where we have 31 who are not vaccinated. We have children who probably were vaccinated when they gave birth to them at a particular age and then are not now fully vaccinated. And so there's that discrepancy, which we have to cover up. And this is very important for us to see. This is one of the reasons we are calling out for these proposals. This is a very, very foundational treatment and management for children that we don't currently already have in place. And this is why one of the reasons we are doing this. Aside for that, you can see in this current slide, aside from that, look at the trends in child growth measures. It is important to see that between 2020 to 2018, where we conducted the Nigerian Demographic and Health Survey, where 37% of Nigerian children less than 5 years old are stunted, that rate has increased to 40% in 2024. And it goes around also for the wasted 7% in 2018, now becoming 8%. And then 22% children were underweight in 2018. And now that has increased to 27%. So you can see that across board, the trends in child growth measure has really dropped. And this is also one of the reasons we are looking into this. Look at the anemia level or among women of reproductive ages. About 58% of every Nigeria of 10 children, about 5 to 6 mothers of reproductive ages in Nigeria have one level of anemia or the other. That's also not good for them. Anemia is, is a chronic, is a very important measure for blood and for hemoglobin among mothers. And you can imagine if you have a low level of hemoglobin, anemia, results, and that's also impacts on so many things, especially for the children, for pregnant mothers and lactating mothers, as well as mothers, adolescent girls as well. So this is a very, very important aspect of this that we are looking into. It will also interest you that Nigeria ranks about 109 out of 125 countries in the Global Hunger Test and Index. This is indicating a very high level of hunger within the country. So you can imagine why we are also very interested in food security. Solutions that can put an end to food security, or that can provide some answers to some of our food insecurity problems. About 87% of Nigerian women who are at the rate or had a high rate or moderate risk of poor diet quality. This is also because, quite a lot of our foods are not highly nutritious and not nutritious enough also to survive or to support the growing fetus in the womb. And you can imagine that a lot of organizations, WHO, Global Alliance for Improved Nutrition, UNICEF, and so many other organizations have been quite involved in supporting and ensuring that we have some support programs are being implemented, but then it's not enough. And also it's also possible that we have not attended to the most important aspect, underlying challenge for these topics that we're talking about. And this is also why we are really looking into this call for Nigeria. So the purpose of the RFP aims to drive bold, innovative solutions that you have that has proven to be very to be worthy of funding that can help us improve maternal, newborn, and child health in Nigeria. In that way, we can then help accelerate the progress of sustainable development goals, as well as a healthy future for Nigerians or all Nigerians. This is 2024, and the sustainable development goal ends in 2030. We have less than 6 years to go to ensure that we achieve some level of sustainable development goals. According to the recent study, we are not there. We are not improving as much as we should, across the different goals. The targets are not being met, and so as much as possible, this is also not for the sake of meeting the sustainable development goal, but then for the healthier Nigeria. This is very important and at the center of our call for this organization. We have given different sub-themes. We have highlighted different sub-themes in our application, and I'm going to go through them one after the other. And one of the most important sub-theme for us is the ability the accessible technology-driven solutions. We want to see submissions of applications that will tackle or we address solutions for maternal, newborn, and child health and diagnostics. So are there solutions you're providing that can provide low-cost diagnostic and then, of course, monitor innovations in maternal, newborn, and child health care? We want to see solutions around telemedicine, digital and mobile health solutions in maternal, newborn, and healthcare. You can imagine how overwhelmed our health system is currently, and then we want to see are there solutions that can help streamline the process of the healthcare system and reduce the stress and the pressure already on the health system. We want to see point of care diagnostic innovation also in MNCH. That will be very good to see those applications within this sub-themes. We want to see applications that can support strengthening the maternal and child health through nutrition innovation. I just gave you a bit about information and statistics around stunting, underweight, as well as wasting among children less than 5 years old. We want to begin to see applications that can help us in strengthening that process through nutrition, micronutrient supplementation, fortification, and biofortification innovations for the MNCH. Are there also innovation around nutrition for the mother, for the child, and also for the young children as they grow up in their life cycle? So this is the second sub-theme for this RFP. We want future-proven diets for maternal and child health. We've seen quite a lot of solutions, come from the different countries of the world on for mothers and then for child health. And this can only come up, through sustainable agriculture innovation, which can also help in improving dietary diversity. We realized that for dietary diversity in Nigeria, also among children less than 5 years old, the prevalence or the level of diversity on the food they consume is quite low. And this is already also in the National Food Consumption Survey that was conducted recently. Is it possible to have quite a number of other foods, coming up, to support the dietary diversity of these children? Yes, those innovations are also part of the innovations we're looking forward to seeing. Climate resilient food innovation as well to improve dietary diversity. Yes, there's quite a lot of challenge with regards to the cultivation of some crops as a result of the climate change, as a result of the current type of climate we have in Nigeria, as a result of flooding, as a result of droughts, which has become a major issue also in most part of Nigeria, especially in the northern part of Nigeria. So we want to begin to see, are there innovation around food that can support dietary diversity? Because those challenges would also not allow and permit farmers to grow and cultivate foods that can support dietary diversity for this target group that we're looking forward to. So we want to begin to see those kind of innovations that can support these processes. For the eligibility criteria, we said the lead applicants must be affiliated with a registered organization. or institution that has been in existence for more than 2 years, for 2 years and above. Yeah, if your organization has been in existence for 2 years and above in Nigeria, yes, you are qualified to apply. The lead applicant's organization or applicant also must also be legally registered to operate within the country and be in good standing with relevant authority in Nigeria. The eligible organization must also be registered as a non-profit. So now we're looking at the different types of organizations that can apply. It could be a non-profit organization, it could be a profit organization, it can be a private organization. However, we are not taking applications from sole proprietorship. A one-man business is not something we would want to promote for this application. We are encouraging application from private and public research institutes, private and public academic institutes, research centers, and social enterprises within the country, Nigeria. So if your organization falls within these criteria of within these types of organization or classification, please, you are free to apply for this RFP. Individuals with institutional affiliation, yes, we want, if you because as much as possible, we want to ensure that we receive application from everyone, and everyone is included as much as possible. So if we have individuals coming together to put up an application, we want applications from individuals with institutional affiliation who are not applying on behalf of the institution. You are also eligible to apply directly. But the projects, of course, like we said, we prioritize funding institutions, not individuals, as much as possible. Then we are saying why local and international collaborations are encouraged, because this is part of our duty to see how we bring together international collaborators, also to solve our local problems within the country. What we're saying is the lead applicant must be Nigerian and must have an affiliation with a Nigerian organization. And so as an organization, you can decide to have collaborations with international organizations or international individuals or researchers or entrepreneurs, business people outside the country. Yes, of course, because you want to derive some expertise and experiences. You want to get some more knowledge and all of that, and then they are part of the team. Yeah, that's very fine. What we're saying is that the lead applicants for this RFP must be a Nigerian, must be affiliated with Nigerian organization or institution. We want someone who has a local understanding of the challenges, and that can really understand what solutions we need. But then you may not have the infrastructures or facilities or the expertise to put it up in Nigeria. So yes, that's why we're also encouraging that international collaboration for this application. Applicants must have the necessary expertise, resources, as well as team and infrastructure to successfully implement their proposed project. We found a number of questions coming in to ask about the fact that, well, we may have to get some of the infrastructure resources from abroad. Yes, that's also very possible. Yes, because we do not have, maybe you don't have that in Nigeria and it's not obtainable. But as much as possible, we encourage that infrastructure in Nigeria that can help you implement your project seamlessly, and you don't have to go through all the exports and the imports and other processes that can affect your timeline and the quality of your outcome of your study of your projects at the end of the day. Applicants must also have a proven record of accomplishment of working in the thematic area which we have put out, which is the maternal, newborn, and child health. We would like to see within your CV, within your experience, within your past projects, that you have accomplishments of working in this thematic area we have asking you to submit a proposal for. So that's good. We look forward to that. The proposed projects also must be implemented within the country. We would not allow, or we would not accept or receive applications where the project has to be conducted outside the country. The project has to be conducted within the country, because we are looking for projects that can provide solutions to local challenges. And so that local challenges has to be Nigeria. Going forward on the eligibility criteria, the teams or organizations that have received any grant, challenges, or other fundings in the past are eligible to apply, but you must also demonstrate how this current proposal or current RFP is different from the previous work which you have received funding for. In other words, we are not going to fund a project that already received previous funding, from other organizations or in the past. The project is currently going on and has received funding before, and so we do not want you to submit same proposal for this current application. Monitoring and evaluation, learning and dissemination is very important and is very central to this particular application. And as much as possible, please, we would like you, and we are encouraging you that we would only receive application from organizations or from individuals or applicants who are willing to be part of our monitoring and evaluation, learning and dissemination, as well as amplification activities throughout this project implementation period. We have developed guidelines on open access, especially for dissemination process. There are situations where we can be a bit flexible with dissemination and amplification of some activities of your work. Yes, we have to go through that together individually with different organizations. And so yes, indeed, but we must be willing to be part of the whole process. You are going to be assigned monitoring and evaluation team who are going to be taking a look into what you're doing. And this is also very important for the organization. So the application process is, we already have a grant management system in place, where you are currently, or where you have to make your application for the RFP. It's been launched and is live. And so at the end of this month, that system will close. Yeah, because that's the end of the application submission. The application process is currently going on. At the end of January, we will commence the reviewing process, like I said earlier, which will end in March. And then in April, we will give a notification of award and of course contracting. And then from there, after due diligence have been conducted, grant disbursement will happen among selected candidates, applicants. And then, like I said, grant monitoring and reporting will also follow. And then before we close the grant process itself, especially you remember my colleague mentioned this is a seed grant. And so that ends, and then we can move forward straight to the next stage, which is the scaling up phase, which is a follow-up on this current grant. For the application process step-by-step guide, we encourage you to kindly please check the GCNG portal on the Grant Challenges Nigerian grants platform. Click on this. If you click on this link, yes, or if you go to this link, you would be able to register your organization or register your interest for this application. And then from there, you can see the different step-by-step approach to questions that have to be answered. And the first set of questions that have to be answered are the eligibility questions, which we have put together to ensure or to gauge your eligibility for this application. There are 7 questions which you have to answer right. If you do not answer them rightly, you won't be able to move to the next stage of application. If you have answered them right, yes, you will be able to move to the next phase of application. So as much as possible, please take a look at those questions before you submit them and be sure that you have provided the right answer to them. We also would encourage your honesty and sincerity in answering those questions. If you have any questions that you think you need our attention, you can send a message to us. You will see the email address at the end of this call, at the end of this message, of this presentation. After the application has been completed, and we are going to commence the reviewing process, and there are 4 major reviewing process stages which we have to go through. And the first stage is called the administrative review stage. Administrative review stage looks into the correctness of the information you have provided, how adequate are they, and then we will ensure that you have submitted the right information. If we realize that you haven't submitted the right information, you might be called to edit your application, and then we can take a look at it again and review it. Like I also said earlier, we encourage you to be very sincere and honest in your application. We will be conducting due diligence also for this administrative review stage. And as much as possible, we will disqualify any candidate where we realize that you have submitted a fake information or a very dubious information as much as possible, we will disqualify those applications. So please, we are encouraging you kindly look at your application very well and then ensure that you have given us the right information. So administrative review stage will look into the correctness and of the information that you have provided for us. The team then passes over the applications that have been selected that have provided adequate information to us straight to the technical review committee. We do have a technical committee, which is the collection of experts across the world, not Nigerians alone. We have gotten quite a lot of people from the different places where we have who have expertise in MNCH and have shown in their previous work that they are competent enough to do this. And so even in their research work and all of that, and so they are going to be technically reviewing your applications independently as well as objectively. They have got criteria for reviewing, and they are going to be using these criteria to review your application. So what you see is beside in the right-hand side of your screen is the proposal will be evaluated based on the criteria such as originality and creativity, on innovation, on the scientific and technical excellence. We want to also receive projects and projects that can be scalable, innovations that can be scalable. And so this is what technical review team will be taking a look into, and they will be ensuring that yes, these innovations can be scalable. It is not an innovation when the larger population cannot have access to it. It is not an innovation when it is not cost effective. It is not an innovation when it's not accessible, when it's not available and affordable. So as much as possible, we are encouraging you to ensure that your projects or your innovations are accessible, available, affordable, and they are also there for everyone to use. We will look into potential for impact, for the community and the society where you are taking a look into, and then alignment with the thematic areas of focus. We are already receiving applications that are a bit outside the MNCH, and I must say that already. That's one of the criteria that we'll be looking into. It's not aligning with the thematic area, so those applications stand the risk of being disqualified. That's what the thematic area, the technical review committee will be looking into. We have the monitoring and evaluation stage where the monitoring and evaluation company, organization, or the team will begin to look into your proposal, look into how realistic your proposal, and then we look into your monitoring and evaluation plan, which we have also asked you to put into the application. And then they also have their criteria in also reviewing that aspect of your application. We have the board review. At the end of the monitor and evaluation review, the monitor and evaluation consultant or organization or team will pass over the remaining selected applications straight to the board. The board then goes ahead to review each application, and they are going to be selecting and shortlisting the final 10 organizations or projects or innovations or applicants who will be funding for this seed phase of this RFP. So as much as possible, like I said at the beginning of this presentation, we would like to provide you some tips which we think you should put into consideration when you are applying for this RFP. We encourage you to be articulate in your description of your project and of the context of the problem, and ensure that it is in the context of the local setting, and so not a global setting, but we want to solve local problems. And as much as possible, kindly, we ask you that you articulate the local context of the problem. This is not what we usually see, among applications. We are also encouraging you to focus on measurable impact, scalable and sustainable innovation. This is not also far-fetched. This is also something you can request, you can put into your implementation plan. Ensure that your processes are realistic, time bound, are realistic, and also sustainable, scalable as well. Emphasize on community engagement and stakeholder collaboration. Yes, please. We do not encourage you to present an innovation in isolation. As much as possible, we would like to drive and promote collaboration and ensure that the community and the society with which you are providing these solutions to can also be part of the whole process. Help them to understand what you're doing, what is the benefit for them, and how can they be part of the whole process. They then can give you necessary information on what they think will be useful for them. Please do not present an innovation in isolation of the community. Please engage with the community and also promote collaboration also for these solutions. Use data and evidence to strengthen your proposal. There are quite a lot of data around on the challenges we currently face. We encourage you to please use the data to strengthen your proposal. That's very important. And avoid the use of generic solutions. Tailor your solution to the local settings. Some of the pitfalls we usually notice among our submissions or among application is that people usually will submit incomplete applications. We have many incomplete applications currently in the system, and well, the system we have created will not allow you to submit an incomplete application anyway. So, but this is also one of the things that goes up, happens in most applications. And then you have missing required documents that that can also impact or negatively impact your application. So please ensure that you have given us necessary and complete applications documents as much as possible. There is always that lack of alignment with the thematic areas. And just like I said, we are currently taking a look into the application that have been submitted, and we have discovered some applications are not in alignment with the thematic areas that we have at TEMAS, which is maternal, newborn, and child health. There is that failure to also demonstrate scalability. It's not enough to it's not enough to get funding for the seed phase. We would like to scale up your idea, get some more funding for you to be able to scale up your idea, and then ensure that the right collaborations, the right stakeholders have access to it, everyone have access to it, and then it can improve the life and the well-being of the people, of the target audience with whom we have created these innovations for children, for infants, neonates, for their mothers, adolescents, and so on and so forth. We're looking straight into all of these target audiences, and we expect that your solutions will be scalable enough to reach those unreachables, the rural area and the urban as well, and be able to serve the necessary stakeholders as much as possible. There's always the overestimating and underestimating project budgets. Please consult finance experts as much as possible to with regards to your budget. We see a case where we say, well, we are providing equivalent of $50,000 or 60 million euro, and most of the time, a lot of organizations and applicants measure up to 60 million, even when they don't need up to 60 million. This reality is we are going to check, and then as much as possible, we would know when you have overestimated your budget. But then it's also important to know that if you underestimate your budget, it is likely also going to affect the implementation. And so we are very open to seeing all of these errors and the pitfall. And as much as possible, we encourage you to please take time to take a look into this budget planning. And if you have any questions and you need some clarifications, do not hesitate to send us an email or message with regard to your questions. We've answered a couple of questions, a lot of questions during the holidays, and also before then. And then we expect to hear from you to get your questions with regards to this application as soon as possible. We have the frequently asked questions on the internet on our website. Please visit this page, and then if you think we have not answered your question on that page, please send us an email. There's a support email where we would like to hear from you, and then you will definitely get an information from us with regards to your questions. Thank you very much. That's the end of this presentation.
Thank you very much, Dr. So we have been very busy trying to answer questions as they come in. So I've been told that it appears that I'm frowning. I apologize for that. That's because when I read and I concentrate, it appears. So no, I'm not frowning. I'm trying to respond to your questions in the Q&A. So I tend to be a bit nicer than it appears. So we've been responding to questions in the Q&A. And what we're going to do now, that's because we're trying to save some time. We will now start picking the questions that haven't been responded to. And I'll pass those to Dotun to respond to. From, I think, Dr. Diala, there's a question where it's a very easy one, Dr. So I'll just answer it directly. So it says that, good afternoon, do we need CVs or BioSketch as one of the supporting documents? The answer is yes. So please, I'd invite you to please read the RFP in full, as well as the supporting materials. It's just quite a lot of information. And when you're making your application, at the last, I think it's about the last stage, you're required to upload certain documents, and the CVs or the resumes of your team, the CVs actually of your team are one of the set of documents that are required. So that we will consider answered. It's CVs. I'm not really sure what a BioSketch is. Dotun, do you know what a BioSketch is?
Yeah, it's another CV kind of
CV format.
A lot of time is usually used in the academia. So
Okay.
so I think that's very important. Yes, I think a BioSketch you will even speak a bit better than because it then shows us where you have been engaged, what you have been doing, and then also has a detailed information on your research work, past research work, and the studies which you have conducted, projects which you have conducted, and all of that. Yeah, so that's very fine. Yes, that's good.
Okay, so I guess with respect to that, Dr. Diala, there was a different question earlier asking what format the CV should be in, whether it should be 2 pages, and there was actually a question in the chat that I haven't got into, saying that some people's CV is more than 50 pages and should it be compressed? The thing is, the format of your CV is really not the priority. If you understand why we're asking for the CV, why we're asking for the CV is we want to determine that your team can pull off the project for that you're proposing. So we want to look at the history, the expertise, things like that. So whatever CV whatever format you think works best for you, we can accommodate it. So I think, responded someone else with a similar question. So Dr. Diala, I think if you prefer to use a BioSketch, please do that. Now, there's a question here, Dr., regarding the sub-themes. So I think there's some confusion about whether proposals should make sure they cover all of the sub-themes, or proposals should fall under some of the sub-themes or straddle one or more sub-themes. So if you want to answer that.
Okay. Thank you so much, Bamsa. Also, thank you for whoever has that question. So, in fact, I was going to say that while I was doing that presentation, but I think it skipped my mind while I was presenting. Those are sub-themes, and you don't have to cover everything. We would just want to encourage you to focus attention on where you think your organization is best in, where you think you can provide the right solution and the best solution for this RFP. So you can focus on one. If you think your innovation focuses on 2 or 3, that's also fine. But as much as possible, you are not required to cover all the sub themes. MNCH is a general. MNCH is a general theme, or is a general focus. But then the sub themes, you don't have to cover everything. Just any of them that you think you can provide solutions to.
Okay. Thank you, Dr. So someone is Dr. Farouf is saying, can we list all the documents that should be attached? Because those documents are not listed on the portal. So I think the response here really is that the documents are actually listed on the portal. There's an entire section dedicated to the documents that should be attached, and it lists those documents that it expects you to attach. But even at the very beginning, when you start your application, there's a downloadable PDF at the beginning that helps you see all the questions that you will meet, because some people prefer to work on the questions offline, and then when they have everything ready, then they come and do and then answer the questions and do the upload. So even that document refers to the attachments that are required. So Dr. Farouf, I hope that clarifies. So Professor El Sayed, yes, so we've been seeing questions around what is expected from the proposal. The way we have approached the proposal is we've tried to pick out the most important elements, and that's because it's a multi-step process, and we've made provisions to gather more information at other steps. So I think I have responded to similar questions elsewhere. If you have a full proposal, you can attach it. The attachment does not limit you, so please feel free to attach it. We will, of course, in the early stages, first of all, prioritize the questions that we've asked. So if you did not answer those questions sufficiently, we will not get to even looking at the proposal. So please, the questions we've asked in the grant system, please prioritize those questions, answer those questions, and then if we think we need more information, we will go into your proposal and look at it in detail. That's when there are lots of people who are saying thank you for the presentation, so I'm extending that to you. So there's a question from Dr. Oladosu, which says that an M&E system with one with pivotal parts. Okay. Dr. Oladosu, I think for that, you can just write us an email. We can explore the collaboration. So we'll just limit our responses to the questions. Dr. Obi, whether multiple institutions can collaborate on a project. Dr. If you take this one, and the second one is, can an MOU be used as evidence of previous grants? So let me break it down. Just answer the first one first. Can multiple institutions collaborate on a project? And then I'll ask the second one when you're done.
Okay, yeah. Yes, indeed, that's a capital yes. We encourage this collaboration for multiple organizations or institutions to come together with ideas. So we are encouraging and promoting that collaboration between organizations. It helps with cross-pollination of ideas, and that's very good and we're looking forward to receiving that. There's a question in there that sounds more like, if multiple people come together, or multiple organizations or researchers come together, or research organizations come together, are they allowed to apply for more than one, to submit more than one application? What we said is that yes, you are allowed to submit more than one application. However, you cannot be a PI in more than one application. So you can't be the same PI for all the applications that you have submitted if you are submitting multiple applications, especially if you are dealing with other organizations. So as much as possible, one application, one PI cannot be more than one application. But yes, you can cross-pollinate ideas. You can work together with other research organizations.
Thank you, Doctor. And so, Dr. Obi's second question, can an MOU be used as evidence of previous grants?
I think there's a two-way to look at it. I think yes, there's a capital yes there to say you have an MOU to. I mean, I can imagine that contains necessary information with regards to how much it is going to be, or how much you got, and what your study was all about, and all of that. But we also want to see what is what is the impact of what you did. I mean, of your previous project, and so on and so forth. Yeah. So, but I think yes, an MOU will fit in because it does contain quite a lot of information on the project that was conducted and your collaboration also with the organizations or with the funder.
Okay. I think maybe even simpler is in the grant application platform, we actually just request for the details. So if you want to attach the MOU, it's fine. But really what we'll just ask for are specific details of about the previous grant. I have been expecting this question. We get it quite a lot. My organization will be 2 years in June. Are we still eligible? Doctor, over to you.
Yes, we've received quite a lot of this information, this kind of questions from so many organizations, and I, as much as possible, we want to encourage everyone to apply, but this is also why we have those criteria in place. If it's not 2 years and above, we may not be able to accept your application. This is January, so you still have about 5 months. So indirectly you have 1 year and 5 months. So it's going to be a no. You won't be qualified for this application. We have reasons why we selected 2 years and above, and that's also left to us. Yeah.
Okay. Okay. There's a question from Dr. Oji inquiring if you have access to the slides and recordings. The answer is yes. So this is the second session. The first session, the recording is actually on our YouTube channel. We will put this second session on our YouTube channel as well, and then send it to you by email. So you will get this as well as the other one. There's a question here. Can the same group of that has been answered. Can the same group of researchers submit more than one proposal? The answer is yes, but each proposal will need a dedicated PI. PI cannot head more than one proposal. There's a question around project will emphasize funding institutions and individuals. So Dr. Dumegu, this question has been answered. I think you asked it in the Q&A and I had answered it there. So there's a question about, there's a question here that says, so Dr. I'll pass that to you from Dr. Dumesi, that says that the proposal will not fit into any of the 3 sub-teams, but it will align with the general MNCH theme and whether they can still submit it.
So yes, I think you can still submit it. We are looking at MNCH in all, but we do not have all the list of sub themes that can fit into everybody's ideas or innovations. I would just encourage you to apply, and then when we take a look at these applications of yours, we decide where it falls in. But I can imagine it falls in somewhere, but maybe we just didn't list it. We can't list everybody's interest, but then because it falls within the MNCH purview, I think it's important that you apply, especially if you if you think you're qualified enough to apply. Apart from that sort of thing, I will encourage you to apply, and then we will take a look at it when we get there.
Thanks, Dr. So there's a question about ethical approval from Dr. Hotoro. So Dr. Hotoro, I think we've answered this question in the Q&A. Someone else has asked this, so please just take a look at the questions in the Q&A. But maybe just to help, in lieu of a final ethical approval, you can use your application for ethical approval. Is it compulsory to mention the LGAs where the project will be implemented? I think this is useful. So you can either mention it where you're providing project details, or if you intend to attach your full proposal. So for Timilein, please, if we did not respond to your email, please do resend it. And we'll respond to it. We'll check. I promise we'll respond to it today. So from Dr. Odumegu, with respect to whether the statement that the project will emphasize funding institutions and not individuals. So I think I've responded to you in the Q&A as well. Please so refer to it. Doctor, do you want to answer Dr. Ajayobe's question around patents?
Patents, right?
Yes.
Okay. So if you don't mind, can you just read the question out again? I'm trying to look for it.
Okay, 1 second. So it says, how do we protect patents?
Yes. How do you protect patents? So for example, if you have an innovation that requires that you have to protect the patent, so it's important that you probably seek some legal advice. But I can tell you that as an organization, we have policies on patents, or we have policies on protecting your ideas and protecting your information you're sharing with us. Although, like we said, we are going to share this. Reviewers are going to look at your applications and so on and so forth. And so third parties are going to look at it. But then, as much as possible, we will ensure that you are protected as much as possible. But then, I think it's important that you seek some legal advice. We do not have a direct question or direct answer or FAQ on patents. So maybe something we can take a look at, and we can provide you more information on that.
Yeah, so I think I'd also direct those interested in the questions around patents back to our company document on open access guide. So please refer to that. The nature of the projects that we fund is that they are typically open access. So please refer to it, and that should help. Now, if you have specific questions beyond this, please reach out to us on our contact email, and then we'll try to support you directly. There's been precedents with other Grand Challenges projects on issues regarding patents that we can probably borrow from, but typically our priority is that it's open access.
Yeah, that's true.
For Dr. Yao, regarding proposals from those who work in hospitals, I don't think it matters where that you work in a hospital. Or what matters is that the proposal is aligned to the requirements that we have put out. So please just read the requirements, and that will guide you. So there's a question regarding annual financial accounts for those in institutions. So when we were designing these questions, I think this was one of the things that we investigated. This challenge had been raised that some institutions are not able to provide annual financial accounts. And what we've been able to determine is that typically they actually can. So there have been institutions that have been able to put processes in place to support the researchers who need to prove, especially to foreign funders, that their institution is legitimate and really exist by providing financial accounts. So I think we've been able to determine that yes, this is possible. With respect to international collaborations from Dr. Amaizi, there isn't a lot to explain. It's just that we encourage it. So there's no section asking you for specific information regarding your international affiliations. We encourage it because the problems we're trying to solve usually can't be solved in isolation. And sometimes the way that we define the questions usually requires that you straddle different disciplines in the proposals that you bring forward for it to be really innovative enough for us to consider funding. And some of that straddling institutions often involve, some of that straddling disciplines often involve straddling institutions, either because you're looking for expertise or for one reason or the other. So where you have institutions that are local who want to collaborate with you, really encourage that. It usually strengthens the team and usually makes for stronger results. I think there's even been some foreign institutions who've seen the RFP and reached out to us asking if there are specific Nigerian institutions who want to collaborate on very specific areas. Unfortunately, we do not have the logistics to handle that matchmaking market. But yes, we encourage that. Can we submit more than one document from the collaboration institution, a financial statement from an institution, and a letter of support from the other institution? So I think the documents we have requested are related to the. This is an interesting question. The way we have thought about it is that they are related to the core institution where the PI is located and that will house the grants. And that's because we want to make sure that it is legitimate. And so the role of the partner institutions to bring expertise and other resources on board. So that's the way that I think we would look at it, rather than that there are piecemeal documents from everywhere. However, I think if you believe that there is a case, do go ahead and submit. If we look at the strength of your proposal and think that the documents has to come from a particular institution, then we will reach back. As PhD students, can we affiliate with our study institution? Yes, if they will provide the necessary support. Will this grant fund a special nutrition laboratory setup? I think, Dr. John, just look at the RFP. And when you look at the RFP and the scope of the RFP, it will help answer this question for your team, whether this falls there. Okay, I think I covered all the questions in the chat. Please put your questions in the Q&A. It's easier to fetch them from there. So I'll just go back to the Q&A and continue the questions from there. So I've answered the laboratory setup. So Dr. Olanio wants you to talk about the sentence in the RFP about applicant profile and information to be completed via Good Grants application portal. Actually, I'll do this because it's easy. So Dr. Olanio, what we're saying here is that when you go to the portal to apply, there's a section there that asks about the applicant's profile. So this is usually the PI, the principal investigator or lead researcher you want to provide your details. So that will be requested on the application portal. So are we expected to include our plan for dissemination and amplification in the M&E box, considering the limited characters in the portal? Dr. Do you want to answer that?
Yes. So indeed, I mean, this is a proposal. So it's called a proposal, right? And not a full document. Once you're selected, we will request for the full document of your protocol of your proposal. And then as much as possible, then you can provide us with necessary information. What is important a lot of times in the application for proposal is ensuring that you are providing us with the right information and with the best information as much as possible to help us and to convince us, to help us make decision on your application. So we cannot always provide multiple, or we cannot always provide spaces for applications, because then you have so much to read, and then that takes quite a lot of time and a lot of stress also for the reviewers. So as much as possible, that's why we have created word counts, so that you can provide us with the right information that we need within that word count as much as possible.
Okay. So for Dr. Abdulaziz, you're asking if, providing an attachment will not count against the submission. No, providing additional attachments will not count against your submission. From DICA Initiative, an organization registered with local authorities in 2013, but registered with CAC in 2023. Can we still apply? I don't know what register with local authorities mean, but it's the CAC registration that we were referring to. Is there a specific timeline for the implementation of the proposed project innovation? So from Dr. Okijiola, so please do refer to the RFP documents. Yes, implementation has to happen over a 12 to 15-month period from the grant contracting. So that's when we expect the seed implementation to happen. After or towards the end of that, then we look at those proposals that have potential to scale, and then work with them to see if they can qualify for scale grants. What's the expected number of pages for the full proposal? Professor Eto Kidem. There is no page count. That's because we're asking for specific information in your proposal on the grant platform. However, if you want to attach a proposal, that's fine. Please attach it to be used as reference material, and there's no word count in that regard. No, there is, from Dr. Abdulaziz, it's not a two-stage submission. It's a one-stage. It's one submission. What tends to happen is that some very good proposals will usually require us to reach out to you and ask you for some additional information or clarify some things from you. So that time has been allowed within the review process. So it's not a two-stage step. So everything you need to submit it in the first stage. If we do think we need to reach out to you to clarify certain things, then we will. I'll give you an example. Someone had asked earlier, and I'm sorry I don't recall your name, whether clinical trials will be considered, and the simple answer was yes. However, in some cases, some studies are very specific, very technical, that we probably hadn't considered it, and so hadn't made provision for that expertise within the technical review committee. What we will then do is those reviewing will make a recommendation that it should go to someone with that technical expertise, and then we will seek out someone with that technical expertise. And in some cases, it will be necessary for us to reach out to you for those people, for the technical review committee assessing your proposal, to reach out to you and ask specific questions to help them understand or to challenge certain aspects of the proposal. And so that will happen. But that doesn't make it a two-step submission process. It's just a part of the review process. So I think, again, there's no word count, Dr. Aliu. So sorry, there's no, the sections with word counts when you are applying have, they indicated there that, you know, there's a word count. And I think I have covered all the questions in the Q&A. So I'll just go back to the chat again, make sure we didn't miss anything. So Dr. Hotoro is asking if we submit all required documents separately or as one file. No, preferably separately, not as one file. But I don't think you will penalize you even if you submit it as one file, but please preferably separately. It just will make our lives easier. And whether it should be PDF or Microsoft or Word documents, we have no preference. So whatever is convenient for you. Please do. All right. So we'll just hold it for maybe 2 more minutes to see if there are new questions or if there are questions that we missed. If we missed your question, you can just respond to your question. So you just tag it and respond and just say, you know, missed this question. And we will then respond to it.
Yes.
No, sorry. The clinical trial example, Dr. Fawe, hope I'm correct. It was just an example. It's not to say that we are only accepting proposals that are clinical trials, no. So please read the RFP. No, so Dr. Fawe, someone had asked if we were considering clinical trials as well, and the answer is yes. So it's not that this RFP is for clinical trials. So please take a look at the RFP. With regard to your question about, you know, an agric perspective, rural women, it could fit. You know, we don't know what your proposal is, so just take a look at it, and yes, it just might fit, but we're not able to tell. I see a question has come in the chat. Yes, there will be a recording. There will be a recording of this session, and we'll send the recordings out. When you are applying, Dr. Hotoro, when you're applying at the end, you know, you do one section, it completes, you do one section, it completes. The last section is where you upload all your documents. So that's the upload section. So from the beginning, they told you which documents are required to be uploaded. And then at the end, at the last section, you know, at the document upload section, you then upload all your documents there. Yes, so I think we covered everything now. Dotson, do you think we missed anything? Sorry, hold on, Dotson. Yes, we said we would prefer that you submit the documents separately. There will be no penalty if you don't, but our preference will be that you you do the attachments separately.
I think somebody asked about, I did get what you said about word count. Is there a limit?
Okay, so the The word count one. So what I had said is there are certain sections of the application process that have word counts, and they will advise word count at that stage. So you provide your word count. But if you're asking in regards to your, maybe you want to attach your full proposal, no, there is no word count. We'll treat your full proposal as a reference document. For the question regarding ethical approval, so we've answered a couple of times in the Q&A that for those who do not have an ethical approval already, please use your application for an ethical approval. So we'll use that in lieu. But of course, we also added that if your proposal does qualify, we would expect an ethical approval before we can pay out a grant.
Yeah.
All right. So I think we have covered everything now. Thank you.
Okay.
Dr. You want to say something?
Yeah, that's maybe a comment or a question from Samuel Aliu. He says, is the funding of up to 60 million sufficient to execute a municipal project within 12 to 15 month period?
So Dr. Aliu, Doctor, let me answer this one. Dr. Aliu, the way that I look at this is we have a larger funding. We could either decide to absorb all the risk upfront and provide all of that funding upfront, or test a few proposals and then concentrate the bulk of the funding at the when the seed stage has been proven. And we've gone with the later stage, and that's because we've looked at the evidence from other grant challenges across the world. And typically, for Africa, for example, the seed grants that have been funded have had less than a 10% conversion to scale. So, I mean, we could either dedicate all the funding right off the bat, but I think the evidence that we have shows that it is more prudent for us to provide seed funding for individuals to prove their concept and show potential for scale, and then we then provide the scale of funding, which is a bit more significant. So I think that will be our arguments there. For Dr. Ahmad inquiring about how many states to implement the funding, we do not have, that will depend on your project. Your project will determine how many states you want to implement your funding. Yep, I think that's about it. I'm just going to check again. So Dr. Hotoro, when you get into the grant application system, you will see the list of documents to download there. So all of those documents are there. So Dr. Achike is asking if there will be another call for scaling. Yes. However, it's not going to be an open call like this one. It's going to be within those who are provided seed funding. So within those who are provided seed funding, those who have implemented well and have potential to scale will then go through an internal process of applying for scale-up funding, the details of which we can't provide at this time, provide at a much later time. For the question around whether we should separate the research budget, so please refer to So the RFP documents, there is a budget and narrative template, and that is what you are required to use for your budget. In this round, Dr. Fajed, Dr. Morenike, I'm sorry. Yes, there is a target. We will fund 8 to 10 grants, so a minimum, sorry, 8 to 10 proposals. So a minimum of 8 proposals, but up to 10. And that is because if we if we have proposals that we think require a little bit more funding than we propose, then maybe we might fund 8 and provide a little bit more funding. But ideally, we would like to fund 10 at the proposed budget levels. So someone is asking if they stand a chance, Dr. Miriam Yakubu. So we cannot comment on specific proposals, unfortunately. It's the technical review committee who will decide the merit of each proposal. So please, our recommendation will be to refer to the RFP documents and decide if you think your proposal qualifies based on what we're looking for and all the things that Dr. Dotun has said we want to see. And then, put in your proposal if you think it's fine. And whether I should cover the 6 geopolitical zones, not necessarily. That will depend on what you're implementing. To be honest, I would think, for a seed, which is typically almost like proving the concept stage, you can't do the whole of Nigeria. I mean, I don't know what your proposal is. It really would depend on your proposal. Okay. Area of operation, that will also depend on you. So Dr. Shivani, if you decide that, for example, Dr. Dotun provided data on anemia, and we know that, anemia prevalence varies in different regions of the country. If you decide you want to prioritize your project for the region where anemia has prevalence, then, that makes sense. But there can be merit, for doing your project elsewhere. So we cannot say you must only implement in critical sports. In the future, depending on how we design subsequent RFPs, maybe, we could prioritize specific sports and things like that. So I'll give you an example. An RFP was developed for the Ebola breakout, not in Nigeria, in a different country. And of course, you can imagine that RFP will then prioritize very specific regions. So, but for this RFP, it's Nigeria we're prioritizing, and where in Nigeria you want to implement, will really depend on you. For Dr. Ayadike, on agriculture and food systems, the answer is yes. It may not, whether there will be a call for innovations in agriculture and food systems, the answer is yes. It may not exactly have that appellation, but yes, there will be a call in that area. For Dr. Achike, yes, I had answered you earlier, so maybe you had missed it. Yes, there will be other funding calls. And for those, I said that this particular seed grant, we will fund between 8 and 10 proposals. Within those 8 and 10, those with potential to scale would then be invited to apply for scale grants. So the answer to your question is yes, but it's not an open call. It's going to be a closed call because it will be focused on those who receive the seed grants, who then have potential to scale. Those will then be invited to apply for the scale grants. For Dr. Ugu, you're asking if you are eligible to be funded in this seed grant if you had previously, because you had previously received funding from Grand Challenges Canada. The simple answer is yes, you are eligible. However, when you look at the requirements that, I mean, the section that's asking about this, you see that what we're trying to determine is that you are not just repeating the same proposal that you have sent to GCC to us. So if it's going to be in the same area, then there must be a significant difference or addition or movement from where you were previously to what this proposal is then trying to do. And so those are the details that I think would want to see. But the simple answer is yes. As a matter of fact, having received a grant previously is a positive for you because when we get to the point of contracting and due diligence, we take that into consideration. It shows that, you've gone through due diligence with a similar organization like ours who, has found you worthy or credible enough to receive the grant. So it kind of reduces the burden of our own due diligence. But the downside is we want to make sure that you're not using the same grants to apply for same funding across different organizations, because that's going to be a duplication, which I don't think is the case, given how you have described it, but just to give a complete answer. So for Dr. Ogunro, I think I have just answered the same question with your question. All right, Doctor, I think we've covered it. Do you want to put in any last comments before we then draw this to a close?
No, not really. I want to just thank everyone for attending and also for your questions. They're quite important questions. So thank you very much. We are looking forward to receiving your proposals, and then please do put them in and then ask us questions if you think you are unclear about some aspect of the applications. Thank you very much.
Okay. Thank you very much, everyone. As we had said, we will send the recording around. Sorry, am I on mute?
No.
Sorry, I'm sorry. I was on mute, sorry. So thank you, everyone. Dotson, can you hear me?
Yes, I can hear you. Yeah.
Okay, sorry. I think my device is, I wasn't on mute, but I now unmuted the wrong device. So thank you, everyone. We'll send around the recordings. We appreciate you taking the time today, and we look forward to receiving your proposals. Happy New Year again, and we wish you the best for 2025. Thank you, and have a good day.
Thank you, everyone.